How does a DRE check prostate consistency? Have you ever wondered how a digital rectal exam, or DRE, can help assess the health of the prostate? This important screening tool is used by healthcare providers to evaluate prostate consistency and detect potential issues. During a DRE, a healthcare provider will insert a lubricated, gloved finger into the rectum. This allows them to feel the prostate gland through the rectal wall. The prostate is located just in front of the rectum, making this method effective for assessment. The provider will check several key factors during the exam. First, they will assess the size of the prostate. A normal prostate is about the size of a walnut, roughly 2 to 3 centimeters. If the prostate is enlarged, it may suggest conditions like benign prostatic hyperplasia, which is common in older men. Next, the provider will evaluate the surface texture of the prostate. A healthy prostate typically feels smooth. The examiner will look for any irregularities, such as lumps or nodules, which could indicate potential problems. Firmness or consistency is another important aspect of the exam. The provider will gently press on the prostate with their fingertip. A normal prostate should feel firm but not hard. If any areas feel unusually hard or firm, this may raise suspicion for prostate cancer. Tenderness is also noted during the exam. If the prostate is tender to the touch, it could indicate inflammation or a condition known as prostatitis. The examiner may rotate their finger to palpate different parts of the prostate, including the central groove and lobes, to detect any asymmetry or irregularities. It is essential to understand that, while a DRE can identify some abnormalities, it cannot examine the entire prostate. Some cancers may not be palpable through this method. Therefore, a DRE is often used alongside other tests, such as prostate-specific antigen blood tests, to provide a more comprehensive assessment of prostate health. In summary, a DRE checks prostate consistency by physically feeling the gland through the rectal wall. This allows the healthcare provider to detect changes in size, texture, and firmness that could indicate prostate cancer or other prostate conditions. The procedure is standard, quick, and generally well tolerated as part of prostate cancer screening and diagnosis. If you have concerns about your prostate health, it is always best to consult with a healthcare professional for personalized advice.